So this is my seventh and final year of residency training. 7 years of residency training. Why? Why did I do this? What specialty is worth it? 7 years of residency training? Let me tell you about it. All right, so let's talk about residency training. So essentially, residency is the infancy of your career. You are basically not respected, overworked, underpaid, and it's the beginning of your training. You're basically an apprentice. Most of the times, patients don't even consider you a doctor yet, and rightfully so. You just came out of medical school. Now you finally have the responsibilities of an attending physician. However, you're being watched and overlooked by an attending physician. It's organized chaos, and residency is tough. You work long hours, and you get really tired. You learn a lot, you make some great friendships, and honestly, it builds the foundation for the rest of your career. But it's a long time, and it's a grueling struggle. A lot of blood, sweat, and tears go into residency training. Now, how did I end up being in residency training for 7 years? And yes, this is my final year of residency training. What specialty is even worth this? And what specialty am I pursuing by being in residency for this long? These are all pretty common questions that I get on a daily basis, so I figured it'd be easiest to answer it in this type of a format by making a quick video. So let's start with the journey right from the very beginning. So when I was in medical school, I ended up going to a non-traditional international medical school. So I got waitlisted at an American medical school, and I decided not to wait to see what happens with that. I decided to apply to a medical school abroad. I went to a pretty popular Caribbean medical school, St. George's University. After doing my research, I figured that was one of the best. Have things changed now? I'm not too sure, but at that time, that was one of the best medical schools that was not in the United States, so I decided to go with that. Now, when I interviewed there, I also found out that they have a program which allows you to train partly in the United Kingdom, in Newcastle, in fact. So after going on my initial interview, I went on a secondary interview, and I believe there was some additional essays and some more paperwork to kind of consider if I could be lucky enough to train in the UK instead of going to the traditional Caribbean route. So lucky for me, I was accepted, and I happened to start my medical journey by flying over to the UK. I had never gone to the United Kingdom before, always wanted to go to the UK, and I thought this was a brilliant and awesome opportunity to do so. Do I regret it at all? Not at all. So I did 1 year of my medical school in the UK, and after that, I had gone to the Caribbean island of Grenada. Both times, fantastic experiences. Some of the best experiences, honestly, of my life happened during medical school, and that's a sentiment that a lot of doctors will talk about, a lot of doctors will share. At the end of the day, you're going through a very difficult time. It's a ton of information, a ton of stress, but you're doing it as a collective. You're doing it with other students that also have very similar goals. So that's pretty much my experience with medical school. Now, once you're done, you come back to the United States and you do clinical rotations. For me, most of them were done in the area where I lived, and I was rotating through various different hospitals. There's plenty of medical students that also go through the very same thing. And some students are lucky enough that they kind of have an idea of exactly what they want to do, maybe based off of their experiences, their parents, their family, and the types of exposure that they have. For me, it was a little bit different. I came into clinical rotations with an open mind. I really wanted to experience what was out there firsthand before I make a decision and put myself in a category, put myself in a box, and start to really plan for what specialty I wanted to pursue. So with that began the traditional clinical rotations: internal medicine, general surgery, psychiatry, OBGYN. I was pretty open, like I said, and I enjoyed my time in internal medicine, and I really enjoyed my time in general surgery. And what I realized is that what I enjoyed the most was actually getting to work with my hands. I liked to do things with my hands. I grew up building things. I was always into the nitty-gritty details and the immediate satisfaction you get when you do something with your hands and you see the result right away. So with that in mind, everyone would think, you're just going to jump to general surgery. But at the same time, I also really did enjoy the clinical aspect of medicine. I enjoyed the puzzles, I enjoyed the problem solving, I enjoyed the rounding, I enjoyed seeing the patients. So I was kind of torn between internal medicine and general surgery. I worked hard for both, and as you're going through medical school, you become quite selfish, honestly, because you're constantly competing with your colleagues. You'll build some of the best friendships, but at the end of the day, you're all competing with each other for the limited spots in residency. So you start to become a little bit more selfish. And the other thing that's scary about the medical training process is you can very easily get influenced by those around you. If there's people that share the same passion as you may be very passionate and go into a certain field. And if there's people that don't share the same passion, people can sway you. You also are going to interact with resident physicians, attending physicians, some of which may have had negative experiences, some of which may have had personal experiences that are now clouding their judgment, and they may regret their career because of various different factors that you don't know about. And you're just a naive medical student trying to, weed through this jungle and pick up whatever tidbits of facts and information that you can so that you best can make a decision that's right for you. So long story short, I ended up interviewing for general surgery, and I also interviewed for internal medicine as a backup, given the fact that coming as an international medical graduate, it sometimes is difficult to match into competitive specialties. Definitely possible, but difficult. So I was lucky. I got to interview for both different specialties, internal medicine and general surgery. And if you're unfamiliar with the way that the match works, essentially you go on interviews, you as a candidate rank programs 1, 2, 3, however many you have, and the programs also rank you. Then all that information gets put into a computer-based algorithm, and an algorithm essentially determines where you're going to be matched. And once you are matched, you are bound. It's a legal contract. So if you rank medicine higher than surgery and you end up getting a medicine place because the program also ranked you, then that's where you're going to be going, and that's the training that you're going to be pursuing. Now, it's a big decision, obviously, to decide what specialty you want to make, but then it's even a bigger decision once you interview exactly which program you're going to rank higher than the other one, and it's a very stressful time. Ask any medical student, and they'll tell you it's a very stressful time. And like I said, sometimes you get advice, you hear different things, and honestly, you can only judge based off of the experiences that you have. Not every student is going to have the same experiences. People are going to be rotating with different physicians in different hospitals with different circumstances and different stories. So it's very difficult to try to make a decision, but this is what every medical student has to navigate through. Long story short, I ended up ranking internal medicine higher than general surgery, and luckily on match day, I matched into internal medicine. Did I regret it? No. At that point, it was my decision to rank it higher. A lot of people stressed to me about the lifestyle of general surgery and how busy and how miserable. A lot of people use those words. Not my opinion, but these were the things that I had heard as a medical student, and they influenced me at that time. You're young, you're impressionable, a lot of stress, and they influence you. So I matched internal medicine, and here we go. It was time to begin internal medicine residency and the start of my career. All right, so here we were. First day of internal medicine residency, brand new intern, scary for sure, stressful for sure, but that's the experience you have with everyone. You share that experience with everyone. Everyone's stressed. It's the first time you've gone from a medical student to actually first year resident physician. You are a doctor now. These patients are yours. Management that you decide matters. You're going to present them on rounds. You're going to admit patients. You're going to get to do some bedside procedures. And that's where the shift started to happen. So essentially, as residency progressed, in my first year, we had to draw our own blood work. There was a phlebotomist in the morning, but the rest of the day, the residents drew blood work. Also, I had ICU, or the intensive care unit rotation, pretty early on in my residency. And during that time, central lines, thoracentesis, paracentesis, all these bedside procedures were done by the residents. And usually in first year, there was a bit of a pressure to learn how to do these procedures, because for the next 2 years, you were going to be the admitting residents, and you need to be able to do these procedures and become certified. And what that meant is that you need to perform these procedures while being witnessed by the attending directly or a senior resident, and you needed to be essentially monitored while you were doing these procedures, and someone had to actually sign off saying that they observed that you did it, there was no complications, everything went smoothly, and you show some level of competency when it comes to doing these bedside procedures. And as the training went on, I started to gravitate more and more towards these procedures. Again, the gratification, I liked working with my hands, I liked helping people and seeing the effects more immediately than just giving medicines and following up the next day. and rounding on them the next day, I started to really, really enjoy that. And honestly, it stemmed back from when I was a medical student. I remember one time being on one of the wards with a resident physician, and at that time we needed an ABG, and essentially what that is a blood sample from the artery, and usually it's the radial artery that's in the wrist. So the resident was told to obtain an ABG, get a sample of this arterial blood. The resident then asked me, hey, have you done this before, and would you want to do it? And I said, no, I have not done it before, but I would like to learn and do it. And he said, okay, I'm going to walk you through it and you're going to do it. And I remember doing my first ABG. I still remember that. And I remember feeling for the pulse, feeling the pulsatility of the vessel, and then just choosing my spot, hitting the artery with my needle, and then just watching the syringe fill up with arterial blood. And not always, but arterial blood has like a different color to it. And I just remember being successful, and the resident telling me, good job. And then him telling the attending that it was me who actually obtained the sample. Then we analyzed the sample. And those little things really stick out. And like I said, everybody has different experiences. Some people may not experience things that way, but something so simple as that, actually now when I think about it, many, many years later, left a major impact, because that's when I really started to understand that there's procedures, and doing the procedures is very, very rewarding. And honestly, that's something I would like to do for the rest of my life. So going back to internal medicine residency, it's now the end of my first year. I was very much into doing the procedures. I would stay late and help out my seniors, and I became certified in just about any bedside procedure that we were allowed to do as internal medicine physicians. And I would help out my colleagues. A lot of people did not want to do procedures. They wanted to be more rounding on patients, checking labs, ordering meds, more traditional internal medicine work. So they would ask me like, hey, would you mind helping me do this procedure? Would you mind doing the procedure for me? Would you mind teaching me? And I started to become known in my residency as someone who was into doing procedures and willing to do procedures. So I became known for that, and I enjoyed it each and every time. After putting a central line, you have to get an x-ray to confirm that you don't actually have air that collapsed a portion of the lung. This is called a pneumothorax. And I remember just the immense satisfaction I would get after looking at the x-ray and noticing that, okay, the line is there, the line looks appropriate, and there is no pneumothorax. And that's what I really knew, this is what I really enjoy. So I started to think now, I was in my second year, do I want to go into pulmonary critical care, where they do a lot of procedures, essentially become an ICU doctor? Or do I want to do interventional cardiology? They do a lot of procedures. But besides the procedures, I also really enjoyed the imaging aspect of medicine. We would also carry around with us a mobile computer station that allowed us to have access to images, x-rays, CAT scans. And as seeing the patients, I really enjoyed looking at the images and then correlating that with how the patient clinically was and how the blood work looked. And I genuinely really enjoyed that. So in my head, I thought, okay, maybe I should go towards interventional cardiology, because you get to do procedures, echoes, you're looking at imaging, and it's a mixture of imaging and procedures. But throughout my residency, I had a lot of experience with interventional radiology, a pretty new field, not that well known, a branch off of diagnostic radiology. And it was more than just reading CAT scans and x-rays. Instead, they were actually starting to do treatment and managing patients. Been doing that for a long time, but in my hospital, the interventional radiology department started to become more robust. And with that, they were admitting a lot of their patients post-procedure to internal medicine. So during rounds, I would have some of the patients who would come in and get embolization after bleeds. One of them got a TIPS procedure, and I was managing them inpatient as part of the internal medicine team. And then because I'm the one rounding, I'm the resident on the case, I would present a presentation essentially talking about what kind of procedure was done and what kind of management internal medicine can offer post-procedure to help manage the care of the patient. And I would present that to my colleagues and to the attending on rounds. So with that, I started becoming more and more familiar and more interested with what interventional radiology had to offer. At the same time, interventional radiology was in this weird position where there was going to be a state of transition. Interventional radiologists were in the process of becoming more and more clinical and less just diagnostic. It was more clinical medicine associated with that. So they were doing more procedures. They were starting to have some more involvement with patient care. And also, IR was going to branch into its own residency. So before, IR was a fellowship after a diagnostic radiology residency. Now, IR was planning on branching off and becoming a specialty that you can apply for straight out of medical school, just like internal med, just like general surgery. And that wasn't the case when I was going into medical school, and that only happened a few years ago. So when I was a second year, I decided, you know what? What if I was to not go the traditional route, finish my internal medicine training, and use my clinical skills and bring that to interventional radiology? And that right there essentially was the inception of the idea that I had about maybe doing 2 residencies, because IR was more than just another residency or just a fellowship. It was like a combination of a brand new field, and I felt that this is really going to be the changing or a turning point in modern surgical management. Patients are getting older, a lot more comorbidities, our medicines are getting better, so people are living longer, but then they're not able to be traditional operative candidates like before. So having a way to do minimally invasive surgical procedures safely was pretty fascinating, and using modern technology through CAT scans as slices are getting thinner and thinner, ultrasounds, and using that to invent new techniques for tumors, for bleeding, for thrombectomy of clots in various different parts of the body. All that stuff really fascinated me, and after doing a ton of research, I decided, you know what, that's what I want to potentially pursue. So what I did is I actually emailed the chairman of interventional radiology at the hospital where I was doing internal medicine. I was still a second year internal medicine resident at that time. I asked him if I can come to his office. He said, yeah, very same day. He said, yeah, I'm available from this time to this time in my office. And I literally walked in, introduced myself. I said, I know you don't know me. I'm a second year internal medicine resident. And I kind of laid my pitch for my idea. And he looked at me and he thought, I could tell in his eyes, he thought it was a bit crazy, but he was like, listen, if you're willing to do it, this is pretty genius. And it has a lot of potential to it, because IR is definitely changing. IR doctors are now becoming more and more clinical. And with the start of a new residency, if you come in with already 3 years of experience, that's going to be big. And so that's what pretty much started it all. After that, on my free time, I ended up doing some radiology rotations, some shadowing to get a better idea of what they do. And then I presented the same idea to the chairman of internal medicine, my program director, and everybody, was very supportive actually. They, as long as they knew that I wasn't quitting. And I said, no, I'm not going to quit. I'm going to finish internal medicine residency. I'm going to take the boards. I'm going to become board certified. And then I'm going to go into radiology. And long story short, that's exactly what happened. Definitely faced some issues along the way. I had an issue with funding, if you're not familiar, but usually the government kind of pays hospitals to train residents. And if you complete one residency, doing a second residency can be challenging because there's less funding available to the hospital that's going to train you. So if there's a hospital that really is dependent on resident funding, they are less likely to train you. And I did run into that. There was plenty of hospitals that told me that they would not even interview me, or maybe send me a courtesy interview, but they were not going to rank me because they just couldn't afford it. And as much as that was stressful and definitely made the process stressful, I really couldn't find any resources on other people doing multiple residencies. I'm grateful that those places were honest with me and told me that, hey, this is the situation. We can't afford to train you, so either don't apply or we may grant you a courtesy interview. But long story short, I was lucky enough to interview, match at a radiology program, and I just found out that I matched into my final year of fellowship for interventional radiology. And now I am in my 7th year of diagnostic radiology training. Now, throughout those years, you still do some interventional radiology, but now in my final year, I'm going to be doing the ESIR. It's an accelerated track where I predominantly do interventional radiology on my final year of training. And then I have to complete 1 year of fellowship, which, like I mentioned, I was lucky enough to have matched. So now I am a PGY essentially 7. Gotta pick up the phone. Yeah, so like I was saying, now I'm essentially a PGY 7. Usually to do radiology, you have to do an intern year, which is usually in surgery, internal medicine, or like a transitional year in multiple specialties. But because I already was a board certified internal medicine physician, completed an entire residency, I was able to skip that year. So what did I do during that year before I started radiology? I actually held a few jobs, multiple jobs, and I was working as an internal medicine attending, and I tried to save as much money as I possibly could, knowing that for the next 4 years I was going to be on a resident salary. And resident salary isn't the best, but it all makes sense. You come out of medical school, you at least are getting a salary to finally work instead of just doing rotations, which are unpaid and part of your medical school training. And the only issue is that you're in a lot of debt, especially if you trained through like the United States system, then you're going to be in a lot of debt. So that's what I've been doing the last 7 years, and now with the light at the end of the tunnel, hopefully soon will be a board certified interventional radiologist. And that's pretty much how I ended up being a resident for 7 years and what specialty I ended up choosing and pursuing. Now, what are my plans for the future? That is to be seen. Am I still going to practice internal medicine? Probably. I don't want to let go of the skills that I gained as an internal medicine physician, and I don't want to let go of the training that I had, but I still am going to be pursuing obviously IR and radiology in general. But essentially, long story short, I know this is a pretty long video, but I figured I might as well just put it out there and kind of explain my journey. If you have any questions about it, let me know. Drop me a comment. Don't forget to like and subscribe. And until next time, more content related to medicine. Check out other videos on my channel, and I'll see you there.